All right, everybody, Dr. Rafich here from Vet Triage. We're continuing on with this issue of veterinary surgery, February 2022. We're going to be talking about partial parotid sialoadenectomy in a horse with parotid ductal carcinoma, surgical description and case report. And for those who need the anatomy of the different glands, salivary glands in the horse's skull, there you have it. You can look at that as well while we talk about this. We're going to be talking about the parotid gland, so number one here. Large gland. This is a 12-year-old, this study comes out of Auburn University. It was a 12-year-old American quarter horse gelding that had a 10 by 10 centimeter swelling below the base of the right ear. Ultrasound showed a mass. Incisional biopsy was consistent with parotid carcinoma. It was marginally excised with surgery. The lateral wall of the guttural pouch was excised with the mass and was reconstructed with a porcine small intestinal submucosal sheet. Cisplatin, which is chemotherapy. Cisplatin bleeds were implanted in the wound bed prior to closure, and furoxaquib was initiated. Results were post-operative complications include right-sided facial nerve paralysis, difficulty with deglutition of fibrous feeds, and surgical site dehiscence. Wound healing was achieved by second attention. Partial improvement in nerve function was observed within the first 6 months. At 12 months, no sign of tumor recurrence or metastatic disease, and the gelding returned to work. Introduction. The parotid gland is the largest major salivary gland of the horse, located in the retromandibular fossa between the vertical ramus of the mandible and the wing of the atlas. Its dorsal border surrounds the base of the auricular cartilage. Ventral border is dorsal to the linguofacial vein. Rostrally, it's attached to the ramus of the mandible and the masseter muscle, and caudally to the strep muscles. Medial border overlies the maxillary vein, internal and external carotid arteries, hypoglossal and glossopharyngeal nerves, vagosympathetic trunk, and lateral wall of the guttural pouch. The facial nerve and its branches go through the salivary gland. Acinar, ductal, and myoepithelial cells that comprise the parotid tissue can give rise to a variety of benign and malignant neoplasms. Parotid salivary gland carcinoma is the most common form of salivary gland carcinoma in humans, and it accounts for 1 to 4% of neck cancer. Carcinoma is the most common in dogs for parotid gland. Primary parotid cancer is rare in horses. Melanoma is most common, followed by carcinoma. Treatment by total or partial parotidectomy combined with more radical resection in advanced disease can result in long-term survival in humans. Materials and methods. The horse had a 1-year presentation with no clinical signs other than preventing the use of a bridle. They did a standing head CT scan as well, and preoperative testing didn't show any metastatic disease. This is another picture of the anatomy that they have to deal with surgery in this area. So you can see it's quite extensive there. That's the normal gland, normal anatomy. Fine needle aspirate of the enlarged right-sided medial retropharyngeal lymph node showed reactive lymphoid hyperplasia. A donor horse was identified, and they collected 8 liters of whole blood. They medicated this gelding with xylazine, butorphanol, midazolam, ketamine, isoflurane, oxygen, potassium penicillin, gentamicin, and flunixin-meglumine. And then here's a CT scan up top, and you can see the little asterisk there right above the R is the tumor, and then the arrow is pointing to a bone reaction by the ramus. And here's the horse with the tumor on the side of its head. During surgery, they had to ligate the transverse facial vein, the caudal auricular vein, the external maxillary artery, and then the external carotid artery and external jugular vein were repaired with sutures. The right facial nerve was transected. They placed the porcine small intestinal submucosa membrane to the edges of the defect in the lateral wall of the guttural pouch. They placed 18 cisplatin beads. They placed a stent bandage sutured over the surgery site, and then a head bandage. The horse was started on prophylactic aminocoproic acid, and a blood transfusion was given. Here is the tumor on the one picture, and then the yellowish picture there is the yellow part is the porcine submucosal patch they placed over the guttural pouch there. Very large incision. Results: duration of surgery was 316 minutes. The horse had right-sided facial nerve paralysis, including left-sided muzzle deviation, lower lip paralysis, loss of right palpebral reflex. After surgery, they gave the horse procaine penicillin, gentamicin, flunixin, meglumine, dimethyl sulfoxide. They started the horse on oral trimethoprim sulfamethoxazole, artificial tears topically, dexamethasone, prophylactic omeprazole, and then the horse went home 6 days post-op on artificial tears topically, dexamethasone, and trimethoprim sulfamethoxazole, and omeprazole, and firoxib. Carcinoma was reported to be incompletely excised, but angiolymphatic invasion was not detected. The cosmetic and functional outcome was considered good. So here's the tumor up top, both on histopathology, evaluation, and electron microscopy. That's the gray one. And then here's the horse after surgery, looking pretty good. Discussion: 5 types of salivary gland tumors are identified in horses include adenoma, mucoepidermoid tumor, actinic cell tumor, carcinoma, and unclassified tumors. Total or partial parotid sialoadenectomy is the most commonly reported successful treatment in humans, dogs, and cats with parotid gland carcinoma. There's also a risk of sialocutaneous fistula with the surgery. Radiation and chemo have been used with equivocal results as adjunctive treatment of parotid carcinoma in dogs and cats. Radiation disadvantages include recurrence, limited availability, and cost. In humans, systemic chemotherapy with cisplatin have been used as an adjunctive treatment following chemoradiotherapy for unresectable tumors. Intravenous administration of cisplatin has been associated with systemic side effects, including lameness, swelling of the physes, and growth retardation in a horse. Kidney toxicity, other systemic side effects with cisplatin are documented in other species. Chemotherapy alone is the most successful canine, feline, and human response. Cisplatin has been reported as one of the most active chemotherapeutic agents for parotid neoplasia in humans. Intralesional cisplatin, or the beads, might inhibit or impede wound healing and may have contributed to wound dehiscence in this gelding. Firoxicib was administered as adjunctive therapy due to highly selective cyclooxygenase 2 or COX2 overexpression has been demonstrated in a number of human, canine, and equine epithelial cancers and its neovasculature. Temporary facial nerve palsy has been reported to occur following 42% of parotidectomies, with 78% resolving within 3 months in humans. However, with deep lobe or total parotidectomy, up to 90% of patients will develop postoperative palsy. Distant metastatic disease is the most common cause of treatment failure in people. Lungs are the most common site, followed by bone. Of tumors that recur in humans, 90% will recur within the first 5 years. Adjunctive radiotherapy can be effective in controlling local regional disease and high-risk parotid carcinoma in humans. So there you go. Nothing much to say there. It's a pretty unique case. And yeah, it's interesting to know all that information. So, all right, we'll see you guys again tomorrow. Thanks.